Excellent. So it's great to see folks coming in both online and in person. Super. So come on in. Ray, should we go ahead and get started? 6:05. And okay, so and actually, can you on your camera show the panelists the room so we get a little bit of a sense of who they're speaking to? They're waving at you. Hopefully you can see. School of Global Affairs. Excellent. Okay, so thank you all for being here, both online and in person for this hybrid event, which is a fantastic opportunity to celebrate Nancy Krieger's new book, Ecosocial Theory, Embodied Truths and People's Health. I made a point of bringing the physical copy because I think when I saw it online, I didn't appreciate how beautiful it would be. You know, with it's just really got a nice aspect ratio, and it also makes an excellent argument and set of arguments with which most of you are familiar with Professor Krieger's work. You know, you'll see some things that you'll be familiar with, and yet have an opportunity to see them synthesized in a way that you haven't yet seen. And so I'm really delighted to have this opportunity to come together and have the chance to talk about this book. So my name is Anne Pollock. I'm a professor of global health and social medicine here at King's College London. And the plan here is just a basic kind of run of show is that first we'll hear a little bit from Nancy Krieger about the book, and then we will hear from 4 different respondents and their comments, and then we'll have a chance for Q&A and discussion with the audience. We'll try to manage well, both online and in person. And I'm going to keep the introductions relatively short because these people are really Googleable, and I don't want to take away the time that we have to hear from them to tell you about their tremendous biographies. So we will, make sure that you're aware of who you're listening to, and really appreciate and look forward to their comments. So with no further ado, I will pass the book around and I will hand over to Professor Nancy Krieger, who is joining us from Harvard University.
Great, well, thank you very much. I'm delighted to be here today and to be among colleagues who stand for health justice, social justice, and human rights, which is so critical in this time we find ourselves in of tumult, where we can feel the plates of history in their tectonic form shifting. And that's just as true in what's going on right now in the war in the Ukraine. So let me start by thanking my colleague Mauricio for initiating this event hosted by King's College. I'm truly looking forward to the discussion with the panelists, noting that I've been fortunate to engage with Linda and with Mahasin for many years over issues involving racism, justice, and health. I'm delighted to re-meet Anne Pollock and also to newly meet Desi Rodrigues by virtue of this event. Before saying a few words about this book, let me start with a few words of acknowledgement. I begin by acknowledging that as a US person in Boston, Massachusetts, I am on Indigenous land and I pay heed to critical Indigenous thinking. I'd like to also thank my editors at Oxford University Press, who have worked closely with me on this book and my book series. First, Chad Zimmerman, now Sarah Humperville. I'd also like to thank my friends, colleagues, and others at the library for all the support they have given me over the many years to do the kinds of work that I do, including among all Pam Waterman and Jarvis Chen for their many years of creative collaboration, helping me translate my ways of using ecosocial theory into real world research. Additionally, support for this book was provided by both my 2019 sabbatical funding to develop the book prospectus and also my American Cancer Society Clinical Research Professor Award. So a segue to the engaged conversation that I look forward to having with the panelists, since it's a live discussion that really makes ideas come alive. I'd like to share a few brief excerpts commingling text from the book's preface and other bits, and conclude with a few thoughts about the present moment. And these are about 10 minutes worth of comments, which is what I was asked to give, just to give you a time frame. So I'll start with an excerpt from the preface and then other bits. Health, illness, birth, and death. They comprise the embodied truths of existence of our planet Earth for every single biological being. It is an elementary truth that to live is to live embodied. People and all other living beings are constantly engaging with and depending upon and shaping the social, biophysical, and ecological context in which life transpires. This translates to incorporating, literally bringing into the core, the body, that is, embodying biologically, the dynamic context in which our lives are embodied. Patterns of population health, including in the case of people, health inequities, constitute the living record of how each population and our planet are faring. Yet elementary truths are never as simple as they appear to be. This book aims to provide a systematic rendering of the ideas and causal claims entwined with the notions of embodying injustice and also embodying justice, and what the implications are for public health and social justice in many interlinked forms, including but not limited to racial justice, economic justice, reproductive justice, environmental justice, climate justice, indigenous justice, queer justice, disability justice, and more. The basis of this construct is the ecosocial theory of disease distribution, which, as I explain in chapter 1, and which I first articulated in 1994, have been elaborating since. Theories and their causal constructs matter because they can be a source of power for good or for ill, but especially when deployed and contested in systems of governance, economics, and policies that set the terms on which people on this planet can either thrive or be treated as entities to be exploited for the private gains of a few. Using concrete examples to illustrate critical concepts, the goal of this book is to use the ecosocial theory of disease distribution to promote clear thinking about the distinct but connected realities of embodying injustice and embodied truths, together at play in the lived realities of emergent embodied phenotypes. Among the examples considered are, in chapter 2, some of my own work on Jim Crow and the ongoing racialized health inequities in the US, the social and biological realities of breast cancer inequities, and the combined physical and social relationship hazards on workers' health. Additional examples in chapter 3 pertain to embodied truths and causal narratives in the service of health justice in relations to police violence and climate change, and also the links between fossil fuel extraction and sexually transmitted infectious diseases, the health benefits of organic food, for whom, public monuments, symbols, and the people's health, and light, vision, and the people's health of the people and other species. Running throughout is a call to reject biological essentialism and instead to embrace embodied integration of soma, psyche, and the social and biophysical world of which we and all organisms are a part, co-inhabit, and co-create, albeit in the case of people, not equally so, but another world is possible. Finally, to help situate my arguments, this book is the fourth in a series I initiated and am editing for Oxford University Press. The first was on political sociology and the people's health by Jason Beckfield. The second on climate change and the people's health by Sharon Friel. And the third on critical epidemiology and the people's health by Jaime Brau. And I'm happy to say that 2 additional books are in the works and others are in discussion, including the 2 in the works are on causal inference in the people's health, and another one on epigenetics in the people's health. And among those in discussion, one is on indigenous well-being, settler colonialism, and the people's health. I mention these additional books because they illustrate how I use ecosocial theory to focus attention on different aspects of how people embody this world that we both live in and shape, and how epidemiologists and others in public health can seek to understand these processes and alter them with a commitment to advancing health equity. And it is so rewarding to know of the good work that so many are doing, drawing on different kinds of expertise that can help expand this understanding and foster fruitful work for health justice. And as for the actual context of writing, I began working on this book's text in mid-January 2020, when only the whispers of a possible new infectious disease with pandemic potential began circulating into global awareness. I continued writing until mid-March and then had to halt when the demands of dealing with COVID-19 and health inequities in the US, on top of all the other COVID-19 disruptions to work and life, became a priority. Added to this was the horrific public murder of George Floyd on May 25th, 2020 by the Minneapolis police, one which, building on far too many before, sparked subsequent weeks and months of mass protests throughout the US and globally against not only police violence, but also structural racism more broadly. Addressing racial injustice in health, including in relation to other forms of social injustice, has been central to my work as a social epidemiologist since the start of my professional career. It's indeed part of why I entered the field. In March 2020, I thus put aside work on this book, given the urgent need to put my epidemiologic skills swiftly to use in the urgent work at hand regarding the data, debate, and action around COVID-19, police violence, and structural racism more generally. I was able to revisit the writing in brief moments during the summer of 2020, then put it aside again for much of the fall, given the demands of school, the pandemic, and the presidential and other elections. Nevertheless, in late December, as contests over the elections began to recede and vaccines began to become available, even as COVID-19 in the US continued to spin out of control, I did return to my writing, and I completed a first draft just days before the anti-democratic violent assault on the US Capitol on January 6, 2021, and in February, with comments from colleagues in hand, revised while the impeachment trial was underway. This is writing in the real world, in context. Living through 2020 and the myriad efforts to mobilize for health justice served only to strengthen my resolve to prepare this book. My intent is to provide clarity about the nature of embodied truths revealed by population patterns of health, so as to hold accountable the systems, institutions, and individuals that promote the degradation and plunder of people on this planet for the few, for the benefit of the few. During the past decade, there has been a global rise in reactionary attacks on the ideas, policies, scientific evidence, and movements needed for people and life on this planet to thrive equitably. The urgency of repelling and exposing these repellent attacks is more important than ever. Yet when it comes to the people's health, we need not only critical political and economic analysis, but also deep engagement with biology in societal, ecological, and historical context. Such knowledge is necessary on its own terms for effective action, and also to counter dominant narratives that continue to attribute primary causal agency to people's allegedly innate biology, AKA genomes, and their allegedly individual and decontextualized health behaviors. Hence this book, to illuminate critical ecosocial theorizing about embodying injustice and embodied truths, so as to strengthen work for the people's health. The collective challenge is for we who value health equity and human rights to contribute to our part of the global project of ensuring the terms whereby all can thrive, alive to the sensuous possibilities of living engaged, generative, and loving lives on this planet for generations to come. And to start wrapping up, here we are in March 2022, 2 years into this pandemic, one that has, as I previously noted, as of so many others, has pulled the thread exposing the deep fissures and inequities, including health inequities, within and between countries. To me, in the US, it is a time of 2 steps forward and 3 steps back, a time that underscores the literal life and death stakes at work for a healthy, sustainable, and equitable world in the arguments I present in this book. In short, in these 2 short and in other ways incredibly long years, we've witnessed public health and anti-racist work ascend in public prominence and impact in the US, only then to bear the brunt of predictable backlash. As we hold this discussion, public health and epidemiology in my country are in the crosshairs of partisan attacks led by diehard libertarian market and anti-democratic ideologues who for years have been undermining government regulations to protect the people's health, including workers' health and environmental health, and who have been joined by various kinds of rapacious cyberspace hucksters who reap fortunes peddling misinformation, hate, and bogus remedies, all the while preying on people's anxieties. Novel gains to challenge racism in medicine and public health and in education more broadly are encountering fierce backlash, as attested to the financially primed furor over teaching about history of racism in US society, bankrolled by the same ultra-conservative funders who have bankrolled climate denialism, voter suppression, and gerrymandering, plus attacks on environmental regulations on unions, and now on mask and vaccine mandates. That is, anything that gets in their way of doing freely with their property and profits as they like. And at the same time, across the globe, in country after country, countless groups and individuals are also standing up to protect their communities' health and fundamental human rights. That is, the quintet of economic, civil, social, political, and cultural rights that are essential for human and planetary well-being, and also challenging the gross and rising inequities in wealth and power that are tearing this planet apart. My hope is that those of us in epidemiology and public health more broadly can contribute our small but vital part to the task of exposing and explaining the embodied truths manifest in the people's health, and provide action, evidence for action to secure a world with an equitable, sustainable, democratic, and joyful future. Thank you.
So thank you so much, Professor Nancy Krieger, for giving us such a lucid and powerful overview of this really fabulous book and indeed body of work. So now we'll move on to hearing some comments from 4 invited speakers. The first of whom is familiar to many because until recently he's been at King's College London, Mauricio Avendano, who is joining us from the University of Lausanne.
Thank you so much, Anna, and thank you so much, Nancy, for this incredible opportunity that you give us to hear you. I'm going to share my screen. Hopefully, you're able to see it. Okay, fantastic. So let me start. Let me start by saying that just a little slide to say that I have to confess my own potential biases. I've known Nancy's work for more than I can tell, but I know that she's been more than 35 years doing social epidemiology research, but also she's combined this with an incredible advocacy and activist linking questions of social justice to public health. But apart from that, she's also been an incredible mentor and source of inspiration for my own research and that of many social epidemiologists. And for that, I'm really grateful, and it was wonderful to see this book put together all these ideas. So let me start by just giving a few points about what I think in my own sort of interpretation is the book about, and I'm going to take a few quotes from the book, but I'm going to try to interpret them with my own thinking. So what is the problem that this book is trying to solve? And I think, to me, from my own perspective, one of the problems that the book is trying to solve is that sometimes in social epidemiology, we are so focused on action and taking a look at what we can do to solve problems that we sometimes don't step back and think about theory. And I think what's really wonderful about this book is that it tries to systematically put together ideas and bring up the notion of embodiment and how social justices influences health distributions and the implications of different forms of social justice for population health distributions. And I think it is really a wonderful opportunity to bring ideas that have already existed for many decades, but that are brought into new light. And the reason why I love this book is because it takes those theories and try to take an empirical perspective to link those theories to contemporary social epidemiology questions. And I say contemporary not because they haven't been around for a long time, but because they have gained prominence in the last couple of years. I don't need to list all of them, but just, as you know, racial justice, economic justice, issues around environmental justice and climate justice, all of these are issues that have gained prominence, and it's really useful to use this theory to try to engage with those issues. Now, I really appreciate the way the book really engages with historical cohorts and life course in assessing the impact of potential interventions, and also the fact that it doesn't only provide theory, but it tries to provide a framework to inform critical and practical research actions. Now, the book is structured around 3 chapters. The first one in which we hear about the theory, the second one in which we see clear examples of these so-called contemporary social epidemiology issues in relation to this theory, and the third chapter in which we look at the challenges and the sort of ways in which we can advance health justice. And I want to focus my comments in the next couple of minutes on this third chapter. And let me start by one quote from the book that I thought particularly enlightening to me. So Nancy tells us that embodied truths of inequitable harm, coupled with recognition that emergent embodied phenotypes can express not only health inequities, but also health equity, provide an integrated basis for multi-sectoral action for health justice using the levels of research, organizing, litigation, policy change, social change, and political transformation. Now, what I think it's really useful of this quote is that it's telling us that ecosocial theory is not only useful for us to look at the health impact of social injustices, but it also actually raises questions about the actions that we can take to address those health inequities that are caused by those social injustices. And I want to sort of raise this issue because I think we're not doing enough sometimes to use these kind of frameworks or these kind of theories, ecosocial theory, to help us also demonstrate how political actions to address those social injustices might also impact health distributions. And I think even though much of research in social epidemiology focuses on emphasizing how social injustices such as Jim Crow laws, police violence, pesticides, fracking may have profound implications, we also need to think, and this is more of a question also for Nancy and the other speakers, how we can use ecosocial theory to more generally ask questions about how the decisions that powerful actors make to address those injustices affect health inequalities. One of the challenges and one of the issues that I focus on my research is how to address poverty. And we have all these different social policies that we know may influence health and that address poverty. But to me, it is not always easy and straightforward to try to think, how do we link these interventions to social justice, and then how that leads to health distributions? And one of the challenges that I have faced in my research is that at times the public actions to correct social injustices may affect population health in ways that are difficult to predict. Sometimes, if I sort of read the book correctly, the ecosocial theory departs from the assumption that the embodiment of social injustice implies always a negative impact on biology for disadvantaged groups. But at times, what I find in my research is that health and social justice do not always go hand by hand. So at times, actions that we take to address those injustices do not automatically translate into health justice. So that, I want to raise this as a kind of critical comment. How do we reconcile the fact that health that does not always move along with these interventions on social injustices? And is it possible that health is also the complex of more social processes that are linked to social injustices, but that are not so predictable in the way that we always expect them? Let me just give you an example of some of the research that I've done. I've done some research looking at the impact of expansions of educational access. And this is an example of a study we did in France, in which we see that a compulsory schooling law that increased the level of education of women, particularly women in France many decades ago, who didn't used to go to college, increased their education, but in some ways had negative effects on their mental health in the long term. So sometimes we can find situations in which addressing these social injustices that we know exist do not actually give us the results that we want to achieve. Another example comes from studies comparing health inequalities across different countries, which show us that countries that we will think as more egalitarian, that address income inequalities, social inequalities more effectively, do not necessarily have smaller inequalities than other countries that do a better job at that. And here you see the example of the US and Finland having both equally large inequalities in health, even though they are profoundly different in the way they address social injustices. So, I want to raise this question about how we think about this and how, this theory can help us understand how issues around regulation, finance, production, the role of the states, the role of the private sector, the way we think about poverty reduction, how all these issues that are more, in a way, technical decisions making of public policy relate and connect with the theory that we've heard about. And then I want to end with a comment that is maybe trying to bring some controversy, but the book to me really brings this powerful argument that in the pursuit of social justice goals, we can use science as a really powerful instrument to achieve that. And in most cases, pursuing social justice goals will align with our desire to improve population health and address inequities. However, pursuing social justice goals does not necessarily always ensure that we're addressing health inequalities, as the example that I just showed you illustrates. And that sometimes can bring some sort of challenges for scientists and for public health and global health activists. What do we do when we find that the studies in which we study the impact of actions to address social injustices do not lead to the kind of health outcomes and health distribution changes that we want? And is it possible that at times the pursuit of social justice goals at times could blind us against scientific observations, as much as Nancy explained very clearly, scientific observations are often blind to social injustices. So I just want to raise that, and would love to hear Nancy's view on those issues. But just to conclude, I think this is an incredibly powerful book that tells us how the ecosocial theory has been so influential in the past, but can also help us think about critical challenges that we face as society today. I think we need more thinking about how we link ecosocial theory to concrete political actions that we can take to address those injustices. And even though social injustices are definitely a key determinants of health, I wonder whether sometimes we have to also think of more complex processes at the macro level, at the micro level, that sometimes may escape us and that might interact with social injustices to produce the health distributions that we observed. Thank you so much, and I give the word back to you.
Thank you so much, Mauricio, for those provocative comments, and I'm sure we'll have some time to engage with the debates that you're raising. But for now, I'd like to move on to our next respondent, who is Dr. Linda Ray Murray, joining us from the University of Illinois, Chicago.
So, good afternoon, everybody. I'm really glad to be here. Sorry, I can't be there in person. One day, maybe we'll be able to do that again. So I want to start off just with a little bit of comments. I can't remember exactly when the first time I physically met Nancy in person, but I do remember the first article of hers that I read, which is the one about the spider. So first of all, I was so excited to see something rational in the title of an epidemiological article on who could see the spider. And secondly, I'm old enough to remember the web of causation and all these notions about how disease and health is produced. So let me just start off by saying I am not an academician, I'm not a researcher, and I'm certainly not an epidemiologist. I'm a clinical physician and activist. And in all the decades where I practiced clinical medicine, I'm now retired, the problem that is brought up not only in Nancy's work, but in all social medicine and social epidemiology is how can we really understand how these inequities are produced in the human body, what Nancy talks about eloquently as embodiment, and what can we do to stop that? What can we do, in fact, to produce health in populations and individuals? So that's the real challenge that we face. This book, as Nancy has told us, is part of a series. It's an excellent series. And when her book came out, some of my colleagues read the book before I got to it, and they said, Linda, you can understand this. Because we have a joke here in Chicago. We say when you listen to Nancy or when you read one of her articles, you just got to relax. And maybe on the third or fourth reading, you'll begin to understand what she's talking about. And this book actually explains her thinking going back to when she first articulated the ecosocial theory. What she does in this book, which excited me so much, is that she gave us the context in which her thinking evolved. And she actually connected the dots, especially in that first chapter, to explain the meaning of this ecosocial theory. That is a great service to those of us, most people in the world, who actually are not epidemiologists. And we actually have had in Chicago a book discussion already on Nancy's book. And we came together, it was a very diverse group. We had a few real epidemiologists, some of our local social epidemiologists based in universities and in our governmental public health bodies. But we had a whole range of different kinds of practitioners, nurses, social workers, activists, community leaders, who all read this book and had a discussion about it. And some of the things that we talked about, which I think helps understand why we were so excited to see this book, is that the typical peer review article is first written for peers, which one could argue are academics, which most of us were not. And they're written in a very rigid way, so that you don't have room to put in a lot of context. They often limit how many references you can use. It's a very rigid, prescriptive way of trying to get across ideas. And you really have to be diligent and disciplined, and I think in some ways a professional in that field to be able to connect the dots from paper to paper and the debates that are going on. And what happens in this book, just like the other books in this series, is that the author is allowed to fully explain an important idea and connect the dots in conversation with the reader. So I think that this book, in a way, is an excellent introduction to ecosocial theory, in a way in which the serial papers that Nancy and others have produced over the decades makes it more difficult for the beginning reader. I think her greatest contribution in all of this discussion is to flesh out the concept of embodiment. And I will say, certainly as a physician, as a general internist, maybe I'm biased and appreciate that, but to put forward the notion that how history, how social organization and structures impact us as human beings, as physical human beings, is a concept that is often difficult to grasp, especially since we do not fully understand the sort of cellular and metabolic pathways that these things occur by. But that doesn't mean you can't observe their impact. And the examples that she uses, especially in chapter 2, give many, many examples where it's clear that this is going on, again, even if we do not fully understand the details of how it occurs. I think the last chapter is the most important. I want to address some of the remarks that the previous speaker made. When you are an activist, it helps, and I think this is the argument that Nancy should be able to convince everybody of, it helps to have a theory through which you can analyze, interpret, and change the real world. And there's debates between those theories. Unfortunately, in public health and in epidemiology in general, there's a dearth of open discussion about theories. And there are lots of hidden theories that are there. So that when you take the position that the normal paradigm of our field takes, it's really a reactionary position. It's a position that ties us, I think, incorrectly to biology. And I think it's a very dangerous theory, certainly historically has been. So to have the ecosocial theory out there as a theory and to be able to discuss that theory and look at it vis-a-vis other theories or partial theories, I think is critical for our field. The thing that I'm really excited about as I read the third chapter is that the question that we have to ask ourselves as public health people is, how can we enrich our discussion, our thinking, our understanding of the theoretical frames that we use when we consider population, the distribution of population health, without looking at and understanding what's going on in other fields. I was very interested, for example, in the work that Nancy did when she used the ICE measures to look at differences in populations. And again, I really had to go back to Doug Macy and read some of that work to really get a better handle on what those measures were trying to do. But there's such a rich array of theoretical debates and arguments and a whole range of other disciplines that we really have to stay in touch with and bring into our field. So this book launch is important, not so much as it is not a new statement, it is a encapsulated, nuanced, richer statement of Nancy's work and the ecosocial theory than we usually are allowed to see in one small talk or in one small paper. So in that sense, it was a great contribution to the literature in the field, just as this whole series has been. The Chicago-based discussion of this book was really excited. People that had finished the book were pleased with it. They really understood in a different way that they hadn't before the basic concepts of ecosocial theory and population health distribution. And our challenges were not that we needed a formula to make change, but that we needed to begin to think of different ways to make change. I'll give one example that occurred to me when our previous speaker was talking about some of the apparent contradictions when you fight for some change in justice, law, and structure, and it doesn't result in what you thought might occur in human health. And so this is the way I often think about this. The Black Panther Party, during its free breakfast programs, very much the same as all of the Office of Economic Opportunity programs that were addressing poorly, but were addressing poverty back in the day. The difference between their program and, say, a program of the Catholic Church or the program of a local health department was not that the food was different or that the tables were different. It was the context in which this program was put in the community. So you might have the Catholic Church putting it in the community saying, you're hungry and we want to feed you. You have the government saying a different thing. The Black Panther said, you're hungry, we're going to feed you, but you need to understand why you're hungry. And you need to understand who wants you to stay hungry. And that way we can together work on how we can make sure that future children are not hungry. So the purpose of this book is to allow all of us to come together as public health, certainly professionals, and the communities in general, and say, we need to think differently about how human health is produced and how human disease is produced. We need to better understand this complicated interaction that's going on all the time so that we can better guarantee a world, as Nancy says, where we're able to live with social justice. Let me stop there, and I look forward to our further discussion.
Excellent. So thank you so much, Dr. Murray, for really highlighting indeed some of the things that I love most about books. I think sometimes academics focus on impact factors and don't pay enough attention to other forms of impact. And I think that this book absolutely captures that so beautifully. So our next speaker is Mahasin Mujahid, who is joining us from UC Berkeley.
Thank you. So it's a pleasure to be here. I apologize, I'm a bit congested getting over a cold, but it's a pleasure to be here with you all. And reading this book made me also sort of go back down memory lane to the first time that I met Nancy, but also the first time that I read her work. And so it was really a pleasure to think about all the ways in which she's not only impacted me and my research team, but a whole host of budding epidemiologists. So in the book, I think that Nancy does a really great job of highlighting the critical importance of theory, as she states, to move beyond observable facts and to provide explanations for why these explanations exist and to identify solutions. And Nancy's ecosocial theory really was an academic lifeline for so many budding social epidemiologists that were looking to tackle health inequities in a way that both honored their lived experience, but also incorporated rigorous scientific methods. And many of us were trained to think that these were dueling realities, that they couldn't coexist, that, you know, sort of incorporating your lived experience would lead to biased investigations. And so being able to read this work and to see how, you know, sort of the two could coexist was really, like I said, a lifeline for so many of us. And so I was reminded when I was reading about one of my former DR.PH students, Dr. Ryan Pettaway, who's a Black male identified social epidemiologist and assistant professor at Portland State. And Nancy featured some of his work in his book because he's doing a lot of work to incorporate ecosocial theory into his scholarship around place-based embodiment. And so one of the things that, one of the quotes in there was that as a foundational construct of ecosocial theory, embodiment is understood as the process through which the outside physical and social world become embedded into our biology. Embodiment then is both continuous and dynamic, as well as both subjective and objective. Our bodies keep tally of our lived experiences, and our physical and social encounters and the health and well-being of our bodies can accordingly bear witness to the context and conditions of such experiences and encounters. So I was actually sitting with Ryan as he develops this writing and to see the connection and the spark that it generated in the work that he was trying to do, the way in which he found motivation to call out the need for mixed methods participatory work, to call out the need for spatially and temporally dynamic and intergenerational approaches that both, as he states, listens to what people say in addition to what their bodies are saying. And so this sort of was really opened up his career. And as I mentioned, for so many others, it provided sort of this lifeline and motivation to think about our work in a different way. So I want to focus my comments on one of the critical themes that I think Nancy did a great job of highlighting in the book, which is the importance of history and how history matters. And I think it's important to remember that one of the most powerful tools of white supremacy is the denial and the erasure of historical facts and data. and especially the data that's the most disparaging to people in positions of power. And it also works to minimize the current day relevance of history. So in her book, Nancy highlights just how recent sort of government sanctioned systems of oppression actually were in the United States. Nancy shares this wonderful table that she uses in her teaching examples at Harvard University. And the table really forces students to grapple with the landscape of current day health inequities, and vividly shows how the present day inequities and premature mortality that we're seeing and we're trying to contend with are really shaped by recent history, very recent history. And in fact, individuals now in their 60s and 70s were actually born pre-1965, pre-Civil Rights Act, during Jim Crow. And so given what we know about the intergenerational nature of disadvantage and advantage, this has implications far beyond those individuals, but for younger individuals and for future generations. And this also reminds me of a slide that started permeating the sort of conference circuit. Many investigators were showing a slide. This began around 2019, which marked the 400th year since the first slaves were brought over on the White Lion ship in 1619. And so if you think about 400 years, it's a long time that Black Americans have been in the United States. And so you would think that these historical insults are so far removed from the current day existence and reality of Black Americans in this country. But if you think about the fact that it took 246 years up until 1865, when the 13th Amendment legally abolished slavery, and then an additional 99 years after that with legally sanctioned Jim Crow, segregation, systemic oppression, up until the Civil Rights Act of 1964, that leaves only the sort of current 55 years post-civil rights, or 14% of the Black experience in the United States that was post-civil rights. Again, very, very recent history. And so in these moments, I think we're really understanding that even this recent history is plagued with the legacy of slavery, the system of structural racism that has replaced it. And so, sort of thinking and centering history is really critical for the work that we're doing moving forward. It's also critical, as Nancy mentioned, to provide the historical context of racialized inequities. And that was a powerful statement for me in this book. And I think, sort of in her foreword, where Nancy acknowledged the backdrop of the writing environment she found herself in, right? So during the convergence of the traumatic events with COVID-19 pandemic, the resurgence of this mass scale viewing, public viewing of police violence that was unfairly targeting racialized groups in the United States. And then from all of that, this sort of call to action around structural racism from leading health organizations, including the Centers for Disease Control. And so I reflected on some of Nancy's comments about the work that she's done. For example, the work that she mentioned on historical redlining and documenting the current day health implications of historical redlining. And it reminded me of my experience with a recent paper that I just had published in PNAS that links historical redlining to present day cardiovascular health. And we were rejected from many journals, and reviewers were recommending that we just focus on neighborhood health effects, that we focus on things that are real, that are rigorously measurable, and most importantly, things that are actionable. And so that was really a struggle in thinking about how the fight for bringing the historical context into the work and being able to get past the gatekeepers of what is sort of quote unquote rigorous scientific knowledge. And I think what we know is that given the persistent and pervasive nature of health inequities and the underwhelming nature of the current interventions, which mostly center on biology and behaviors, I think Nancy's work really reminds us of the critical importance of continuing to interrogate who the gatekeepers are, who are in the positions of power, and who are defining what scientific or rigorous scientific knowledge is, but also to counter these dominant narratives and to think about what constitutes scientific importance and what we consider quote unquote actionable. So as we're trying to sort of build this evidence base around structural racism, we rely heavily on the contributions of this book and Nancy's work over the past several decades. But the challenges are at times feel insurmountable because the fact is that we're relying on sort of data that sort of shows a story, right, of how structural racism is actually doing exactly what it is designed to do. So the very fact that the most dominant sort of strongest magnitudes of sort of risk estimates that exist in the literature are estimates around biological factors, estimates around behavioral factors, and the sort of more quote unquote marginal effects that we might see when we're trying to provide empirical documentation of structural drivers of structural racism in sort of in relation to health inequities. That is by design. And so much of the work that we're doing moving forward is going to be complicated. It's nuanced. The patterns aren't linear. There's not the types of clear, strong gradients that are lauded as the most important scientific contributions, particularly within the epidemiologic literature. So as we sort of go into our question and answer period, I'd love to engage in a conversation about how we move forward and create this evidence, sort of the evidence that we need to develop the interventions and the sort of the health equity sort of based solutions, and how incorporating ecosocial theory can help us contend with and counter some of these narratives. Thank you.
Excellent. So thank you so much for this important reminder to think about the character of evidence at the same time that we think about the character of theory, and remember to always hold our commitment to both truth and to justice. So we'll now hear from our last invited speaker, certainly not least, moving up to Southern California to hear from Desi Small-Rodriguez from UCLA.
Great. Well, Pivot Shift, good day. Pibawona, good morning, depending on where you're at in the world. My name is Desi Small-Rodriguez. Now, Mokshihat Nahasheve. My Cheyenne name is Mokshihat. I'm a citizen of the Northern Cheyenne Nation. I'm a social demographer by training. I engage with a lot of population data, a lot of population health. But I'm coming to you today, and I'm talking to you today as a relative. That is what this book, as I read this book and was engaging with Nancy's newest work, that is what I was reminded of, is my relationships to community, to family, right, to our broader kind of community across the globe, and really thinking about how interconnectedness, if there's anything that we have learned over the last few years, right, particularly through the course of this pandemic, as well as now what is happening in Ukraine and what is happening right here on these soils, right, and what is currently called the US, the massive unrest, the call to action, right, the real reckoning that this country is finally having to atone for, I think, is at its core to me. I see the need for building strong relationships and for all of us to be reminded of what it means to be a good relative. And I often tell people, yes, I'm a researcher, but I cannot be a good researcher unless I can be a good relative. So that is what this book, I want to start off with that. I want to just share a few slides if I can here. I'm having some difficulties with my audio, so I apologize. I've tried 4 different AirPods this morning, and so technology is not on my side. Okay, so let me start here. So I pulled some quotes from the book that I want to relate it to my Indigenous lived experience, because that is something that I'm going to take away from this book and really share with my students and with my colleagues in the work that I do around Indigenous data sovereignty, Indigenous data governance, and really confronting and dismantling colonial systems of injustice and inequity. So in the early part of the book, this was one of the quotes where Nancy says it deeply matters who is telling and testing the stories that bodies tell, and doing so from what vantage, about whose bodies, is what historical, societal, and ecological context. And so it equally matters whose bodies are invisible and ignored. So in the United States, and what is currently called the United States, right, we have to acknowledge that we are all on Indigenous lands, regardless of whether those lands are in our current control as Indigenous peoples. And when I read this concept of who is doing the storytelling and who is doing the remembering, I'm reminded of a massacre, the Sand Creek Massacre, the massacre of the Cheyenne people, my people, which took place in November of 1864. This was a massacre of Cheyenne women, elders, and children. Our warriors were not present in this camp. Our women women, babies were cut out of women's bodies. The mutilation is really horrendous. And this is a story that we remember, that is literally, we carry it in our bodies. And I want to share this photo. When I read this, and when I really was grappling with this concept of embodied truths from this book, I had to think of my grandmother, who's still alive. This is my grandmother, Jenny Seminole Parker. She was born and raised on the Tongue River area of our reservation. Her Cheyenne name is Otseemet, which means brave woman. She tells the story of her grandmother, who was a little girl at that battle, and how her grandmother still has when she died, her grandmother still had a bullet in her leg from that battle. And Jenny, Grandma Jenny would tell us, I remember seeing that bullet that was in the body of my grandmother, right? Talk about embodying truth, embodying violence, and that is passed down generation after generation. So thinking about how history, from a Western perspective, from a colonizer perspective, history is very short. From an Indigenous perspective, history we have very long memories that go back generations, right? So when we think about the embodied truth, this was the story that came to me, was the story from my grandma Jenny. Another quote, another statement from this book that really has me thinking was this one, where Nancy says that the totality of people's lived experiences, shaped by their societies, lodge and manifest in their bodies, such that to understand the state of the people's health, one must start by grappling with their histories and in societal context within and across generations. And I believe my previous panelists also talked about this concept of history, right? So over the past couple of years, and which was during the same time that Nancy was writing this book, we saw the ways in which COVID-19, right, the pandemic ravaged communities that were already ravaged by vast inequities, right, in our healthcare and our education, in our abilities to simply survive. And so I bring to bear some examples here, Indigenous perspectives. We have Sarah Stapp's Pretty Places, my niece, who is yet another victim of the missing and murdered Indigenous woman epidemic across this country. We see here the fact that Indigenous peoples, we have the highest rates of homelessness in many states, homeless on our own lands. We see here how many people we lost to COVID-19. In my tribe, we lost about 70% of our language speakers. So we only have about 30% of our speakers left because so many of our elders died. At one point, we were burying one a day. And then, down below, we see here this is the poisoning of the Colorado River that is the lifeline of the Dene and so many of the Pueblo people in the southwestern United States. And so I show these pictures because when I think about how health, right, what is health? I think about how we are continuously grappling with death in Indigenous communities, and our experiences with death have to be brought to the forefront. And that's what this book did for me. This was a statement that Nancy made about the fact that embodiment is not a metaphor. And when I read this, I immediately thought of Tuck and Yang's work about how decolonization is not a metaphor. And I want to encourage all of you, if you have not read this article, please read it. It's a fantastic seminal piece in our thinking about how decolonization is not a metaphor. We have to actually think about the dismantling of systems and structures. And Tuck and Yang say that until stolen lands are returned, critical consciousness does not translate into action that can disrupt settler colonialism. And that was one of the key takeaways from this book, is in thinking about action, how this book is a call to action. It was written during a time when there was a lot of action happening across the world, but we have to really think about where to from now, where to from here. And so I want to, this article by Tuck and Yang really jumped out at me as I was reading Nancy's book as well. And so I want to remind everyone, and I know that this is being held in London, and so the geographic context is a little different, and I'm coming to you as an Indigenous woman from what is currently called the United States. But I want to share my colonial context in order for you all to understand how I see this book influencing the kind of call to action moving forward, at least for Indigenous health, Indigenous justice. And so this is, what is currently the United States, these lands. This is the GIF glyph that was created not by me, but you'll see here how prior to invasion, prior to colonization, right, all of these lands were in indigenous control. And just over a very short period of time, you see the shrinking of lands in the control of indigenous peoples, such that now we are just on pockets of land, right, that we maintain jurisdiction and control over. But that does not mean that we are not still here. And so we have 574 tribes that are recognized in the United States. We control over 50 million acres of land, and we have over 300 reservations. And so I say that because I want the key takeaway here in thinking about justice and equity. I want the takeaway for my little piece here is for folks to understand that there is no justice and there is no equity for indigenous peoples without sovereignty. And how do we start thinking about sovereignty in the context of health? How do we start thinking about sovereignty in the context of dismantling these systems that continue to harm indigenous people, continue to kill indigenous people? And it really has to start and end with sovereignty, which is control. And sovereignty comes from land. And so in this book, Nancy talked about a thought experiment, right, about racism. If racism were to be gone, what would happen to health inequities? And so I want to just leave you all with this indigenous thought experiment. And how quickly would land back, an actual process of returning land back to indigenous peoples, how quickly would that end the colonial health inequities that we continue to face in indigenous communities? And so I say that, and not as this is a very real question. We are in the middle of the land back movement now across the United States. There are entities who are actually returning stolen lands back to indigenous peoples. And I say this because ultimately, indigenous peoples, we will not be healthy. We will not see the end of health inequities until we have reestablished these connections back to land. And I don't know if many have followed, but the CDC just last year in the United States released for the first time ever, 2021, right? It took until 2021 for indigenous peoples to finally have a national life expectancy calculation in the United States. And that life expectancy calculation, I have a slide here, but I guess it's not on. Excuse me, I'll try to find it. Oh, I guess it's not on. Oh, here it is, was 71 years. Right, so we have the lowest life expectancy of any racial or ethnic group in the United States, and it took until 2021 for us, for the United States to release that, for our data to become released. But for indigenous peoples, we knew this. We've always known this. We've always known that we've had some of the poorest health outcomes, that we lived the shortest lives. And so I want to call attention to the fact that we continue to live in a state of colonization. There's nothing post-colonial about the lived experiences and the embodied truths of indigenous peoples in the world today. And I just want to leave it at that. And thank you for this time. I apologize for the going back and forth. I think this final statement by Nancy, at the end of her book is really what we need to be grappling with moving forward, and thinking about what are the implications, right, of embodying injustice, and how do we bring those into all of our different fields, all of our different disciplines. I think as another one of my panelists talked about, right, we have to come together. This is about an interdisciplinary effort, right? And it's also about seeing beyond the academy, beyond the ivory tower, who are we as relatives? Yes, we are scholars, we are researchers, we are activists, but I want to know, who are you as a relative? And that is what this book really put into focus for me. So Nia-esh, thank you very much.
So thank you so much to Desi Small-Rodrigues for highlighting additional layers of embodiment and the living history that we all live wherever we are on this planet. So with this, I'd like to give Nancy a chance to say a few words in response if you'd like, as the rest of you think about a few questions as we come into about 15 minutes or so of questions and discussion. Nancy?
Thank you. I'm very moved by everyone's comments, and it's, for me, as one person who's writing a book trying to express some ideas, the whole point is to express them and to be in relationship with the reader, to build off of this notion of relative, to actually have ideas be useful. They're not just meant to be ornaments. And so the idea that this book resonated with each of you who have just spoken in the ways you have is really important to me. And to know that you're going to take it and work with these ideas in the many different ways that you describe and use them to sharpen questions to lead to productive, fruitful action for justice and for health justice. So that's like, you couldn't, I mean, that's the whole point of writing something like this. And so that's a very happy thing indeed. So I'm really glad. And I'm also really glad you've raised critical points for reflection as well, because none of this happens without putting ideas together, seeing where they mesh, seeing where they don't, seeing where there are holes in the thinking that need to be filled, seeing where there are holes in the evidence that need to be filled, not just again to complete the record, but to actually, if you're interested in lawsuits and litigation or making policy, you know, one question I always ask myself, I ask my students is, who do you want to do what differently on account of doing this piece of work? It's not just like do a piece of work, it's who's it useful to, and do you know that because you actually talk to them, which gets back again to this notion of relationship and of where you see your work going. It's not just meant to stand on a bookshelf or an article or live somewhere in cyberspace and float around endlessly. So I think that's really important. And so it's gratifying for me to hear these different thoughts come through. It's also gratifying to hear the many different ways each of you were prompted to think about history in relation to the Black Panthers, history in relation to the long histories of enslavement and what the consequences are in the US, history in relation to the long and longer histories of settler colonialism and how that continues to play out on the territories of this, where we are in the, as he said, what is called the United States, North America. Even the fact that the Americas are named as such altogether is an interesting point to itself and crucial. And then also interesting to think about the question of history in terms of the surprises that come and some of the points which I'll start with, Mauricio, that you were raising, which is, you know, how do you think about interventions and what interventions and do you see effects or not? And I think the only point that I want to say, which will cut across all of your different points, is that one of the other points of this book is to stop thinking about policy and intervention so narrowly. Because what happens when you get laws passed is that they only pass because somebody's made a fuss. And they've made a fuss. If it's for progressive legislation, it usually means there's been mobilization of people to actually make the change. If it is regressive and reactionary, it's usually a very small number of people. So you can make the contrast, for example, what it took to get eugenics legislation passed in the United States in the 1920s was very small groups of very wealthy white people who wanted to make this happen. And it was actually led by a lot of people at my university at Harvard. And it didn't require mass mobilization per se, but it did have influence. And you can see counterparts to right now, the work of ALEC, for example, which is this lobbying group that cuts across all the states, has been crucial, funded by a few key, very conservative backers, particularly Koch brothers et al., who then end up influencing state legislation that has influenced all the gerrymandering, influenced the issues around voter suppression playing out at the state level. And then you make the contrast to that to what becomes legislation that happens because of popular organizing for better lives as per the civil rights movement that we've seen. And they're not just simply equal policies being passed. There's different mobilization behind the policies. There's how they also are implemented or not. Look at right now, the difference between what's happening also contrasts with public opinion around the anti-abortion work, that's legislation that's happening in the US. And then you challenge and look at what just happened in Colombia, among many other Latin American countries, where after years of organizing, there's a complete difference in the legislation. It's very different groups mobilize, and there are lessons to learn from that. But the other thing is that when policies change, you have to ask, how quickly do you expect to see what health impacts in whom? And that's where biology really matters, because a lot of economic and social policy literature usually expects pretty quick measurable outcomes to change by virtue of what they've changed. If you change tax law, you see something change pretty quickly and what happens with who's getting taxed at what rate. That's the whole point. It's meant to happen quickly. And they work on a fairly small time scale. Or if you're looking at education change, there's like what happened in the testing scores this year versus next year, which is not lifelong trajectory of what happens when you start to change access and quality. Both matter, they're not the same thing around education. Or simply when you say you're going to change something and get more people health insurance, well, that's great. But what else is happening in terms of what I need for their actual health? That's why there was that thought experiment in the book about if you suddenly were to say, let's just imagine all of a sudden the United States, the country I know best, had no racism anywhere in any form, and everybody lived in equally healthy, safe environments and worked in equally safe and healthy jobs, and et cetera, et cetera. I mean, yes, recognizing the diversity of everybody with our quirks and all the rest, but the fundamental floor is there of real equity. But we all stayed in our same bodies. Would health inequities disappear immediately? Absolutely not, because we've embodied them. And there's what we carry in our lives and our bodies, and then there's also what that does and means for how we raise the next generation. So that's really important, because the timescales, and that's where I find engaging with a lot of social and policy people sometimes, is they don't think about the biological timescales of embodiment and what that means. And I'm not talking epigenetic biological inheritance. That's probably not real, but that's a much longer conversation, very small subset. But I am talking about, you can have impacts when someone is certainly pregnant on what happens in utero and going forward that have lifelong impacts. And that inheritance, really, the word first was used around economics. It was used around inherit, who actually has the legal right to get the property and the accoutrements that go along with that, the property and the income. It got brought into biology. It got brought in the early 1900s. And one of the key geneticists who developed the words that distinguish between genotype and phenotype was horrified that inheritance was being brought into the biological discourse, because he knew it was going to come with all kinds of social thinking that go with it. So this gets back to the precision of terminology that really matters, and to think that the inheritance that matters is the social inheritance, for good or for bad, the inheritance of inequity, the inheritance of deprivation, the inheritance of dispossession versus the inheritance of property, and then what kinds of concentrations of property. So those are the things that I want to be thinking about in relation to all these different ideas. And then to say that, no one study, of course, is ever going to address all of these themes, but it can be inspired to have more precision, to look at the questions, and to look at the questions at the right scales and levels and the right timeframes, to begin to come up with some answers that could be useful in trying to change current conditions, so that we move to a state of being able to, again, thrive sustainably and equitably on this planet. So I'll stop my comments there. But it is important to me that, again, the ideas of histories at multiple levels and multiple ways and multiple time spans really have come out in all of your comments and really point to what we need to be looking at. And the other point about talking about history this way, which comes back, just one last point to Mauricio, to something that you raised, which is that interventions that only deal with justice in general or deal with economic and don't have a lens that's biological will not necessarily by themselves say what's going to happen to health at which level. That's where our part, coming forward as the public health people we are, engaging with real health outcomes, is so critical, and is a unique thing that we can help bring to the table of moving forward these social justice agendas. Because there is a piece of this embodiment that is really, really real. It is, again, it is not a metaphor. It is what we just do because we happen to live on this planet. I mean, maybe it happens in different ways in other planets, and I'm like, read enough science fiction to think that would be fun to think about. But here we're dealing with what's on this one planet Earth that is so precious and so threatened.
Thank you so much, Nancy. Do we have any questions? Would you raise your hand? Leo will come with a mic, or I can open up the camera. Yeah.
Thank you, everyone.
Okay. Hopefully it won't create an echo.
That's okay. Thank you, Nancy, and thank you everyone for your comments, which were all amazing. So the whole thing was really amazing. I was thinking about embodiment and violence and the levels of violence that racial injustice, gender injustice, all of these injustices start to build, not just in our bodies, but in the way we understand the world, and then how that interacts back onto our bodies. So I haven't had the chance to read your book, but do you start to look at individual symptoms and how individual symptoms in response to these injustices affect people on an individual level?
Yes, I do have different examples that pertain to different types of violence that happen, racialized violence, gendered violence, structural violence. But the point is that when you talk about population health, by definition, you're also dealing with individuals' health, right? An individual is always part of a population. So I, as an epidemiologist, will not be looking at an individual per se. I will read literature about clinical case studies. I'm not a clinician who is treating an individual patient. That's really important. There's a relationship there as well. So, but I am understanding that simultaneously, to understand the health of an individual, you need to know the population and society that they live in. That's what you're going to see in their individual body. It's both. And also that individuals are always part of a population distribution. So you can have people that are exposed, for example, to the same kinds of horrific violence, but there may be some distribution of what their individual responses are. And that becomes really important to know. Does everyone have the exact same response, or is there a range of responses? What are the different ways that people have dealt with, for example, in response to being systematic, to experiencing, let's say, sexual violence? How do they respond? What does that mean in terms of their ways that they try to self-medicate, try to get or seek other kinds of help for what the experiences they've had, what it's done to their relationships, what does the relationships with the people in their family, with the people, et cetera, et cetera. Those are things where you then would want to figure out, given the range of what is done and what people express across individuals, make sure if you do research in this area, you're encompassing a range of what the responses might be. But again, not to confuse yourself as the population scientist and epidemiologist as thinking that you know about the individual. That's going to be, it's an individual in their context in all these different ways and in the distribution. So yes, the book does consider some different examples along those lines. And it also, for example, in the last part, the one that links questions of fracking and extractive industries to rates of sexually transmitted infectious diseases, that also discusses what happens when you send in the US context, quote unquote, man camps, which is where a lot of the fracking gets done, the disruptions to what happens with this sexual transmitted infectious disease services, they're usually non-existent, where this is played out in terms of some of it being on Indigenous lands, tied to the issues of violence against Indigenous women and who has sovereignty to even deal with those things. So absolutely, yes, it comes up in different ways. And it's expanding that view of understanding that, again, the violence is rarely just to an individual. It's at reflecting what the population rates are of that kind of expression of violence. And similarly, the parts about police violence that are discussed have to do not only with the people who are directly killed, but also the ripple effects that that has. The people who are witnesses, the people who are in the communities that are affected by this, the ways, et cetera, et cetera. And that's going to be different at different ages. If you're a little kid or if you're a more elderly person when that's happening, what does it do? One of the students that I've worked with, looking at the impact from Ferguson, looking at the impacts of the Ferguson uprising, whereas there are older people who just couldn't go out and get their medicines because of what was happening with the police occupation in Ferguson. And it was just too scary and it was too crazy. And that's not going to be something that typically might get measured as quote unquote, what happened because of police violence, but it was, if you really are going to connect the causal strings. So it's a way of thinking to begin to put the violence in that kind of context, and then to look at what the larger impacts are of that violence, as well as the violence individually experienced, which is horrific by itself.
Thank you. So we have another question that's coming up online, who's asking, history has such pervasive effects on embodiment. How can we address the effects of history to help reduce health inequality?
So two things here in answering. One is that that's a very, of course, important and general question. And then when you do research or you work in a field, you have to come up with a specific question and a specific example and know that you're guided by these bigger questions. And that's exactly what ecosocial theory helps you do. It helps give you those bigger questions and linking of concepts. And for me, when I do a piece of research, it's my mental checklist. Have I done this, that, and the other? Have I used the different constructs? Have I thought about scale and level and space and time and populations and power and all that for the particular piece of research I'm doing? So I can't give you a single answer to that question, But what I can say is there are systematic principles, which is what theory gives you, to start to figure out how to answer that question. And we've heard different histories related here amongst the panelists. And what I'd also like to do is not be the only talking head here, because that feels a little weird to me. And so I'd like to actually invite the panelists to also maybe answer some of these questions as well, or reflect, like, because all of you were engaged with questions of history. And for me, it would be personally also really useful to hear your views as well. So Anne, I don't know how you want to moderate that. Maybe ask the different panelists if they want also to say something. But again, these are important questions, and we have a wonderful set of people here that also have thoughts on these issues. And I want to make sure that those voices get heard too.
Yeah, I think that would be great. So I see that Dr. Murray has turned off her mic. Would you like to speak to this?
Yeah, actually, I wanted to put these two questions together and say that history is critically important. We are such an ahistorical people as a cultural value in the United States. I'm not sure why. But there's one comment that came in the book that our group at least got excited about. It's a question that Nancy raises. I'm sorry, I can't remember what chapter, where there's a debate between Farr and Chadwick. And the question was, is starvation a cause of death? And so when you think about that, at the time this debate was going on, clearly most people didn't think of starvation as a cause of death, an interesting thought for us today. But it's the same thing that we talk about with what's the role of history. Even the previous question that was talking about individual level violence, we, in our discussion group, it came up that we had done some classes, some trainings on violence prevention. And one of the exercises in the training was, what did they think? What was the scale of violence? War between countries, intimate partner violence. And one of the examples was in there was the failure to teach kids how to read. Okay. And so in the grouping then, in the classes we were running, people had debates. Well, if you deliberately fail to teach Black kids or poor kids or Latinx kids how to read, is that an act of violence? And so these same issues come in. Is settler colonialism a cause of death? Is that an act of violence? And if you don't have a historical context to consider that question, if you don't even know what settler colonialism is, you're really at a disadvantage to intelligently address those issues.
Would any of the other panelists like to speak to this question of the individual and the history and how these things might come together to inform action?
Perhaps if I can just say something briefly, there is a beautiful quote from Eduardo Galeano that Nancy has in her book that says, history never really says goodbye. History says, see you later. And I think that's so telling also about what's happening today. And I think it's absolutely true that it's so hard to intervene on the social determinants because history is so pervasive. And I think we have these methods and these theories to address it. But it may be well the case that only after many generations, as the example of Desi was telling, only even if we had the most amazing social intervention that will redistribute land or give land back, only maybe after many generations we'll be able to see any real effect. So I think there's a real challenge for us as people working in public health. Thanks.
Great. So
I'm going to jump in. I'm going to jump in though on one point on that, which is very important, which is that with big intervention, with certain interventions, you can see real fast effects on health. I mean, that's one thing that was very clear in the US after the passage of many of the laws. It wasn't just civil rights, it was also occupational and environmental health legislation that was being passed. It was a very complex concert of policies, but you saw both improving population health and declining health inequities happen in the US in that period from the late 60s till 1980. And 1980 is, of course, the magic year of neoliberalism gone amok. And so then you start to see the widening again. So you can see fast things. You can have vaccination. One of the things that's, if you look in the US, for example, the making vaccination mandatory for kids for school education was a huge, important role, and making it feasible for kids to get vaccinated in reducing childhood inequities and infectious diseases. There are some things that do happen very quickly. And now it's very, very worrisome that the right-wing organizing against vaccine mandates may spread around other policies around school vaccination. And it's like, do we really need to go back and have measles be endemic again? That's a really bad thing. And so I think it's important to be clear that there are some things, or for example, if you change health insurance access quickly and you have something that needs to be treated quickly as part of your health conditions, you can actually have an impact, maybe not on incidence of the disease, but certainly on mortality from it. So where it's treatable. So I think that's, again, the parsing of time between action and outcome is really crucial. And that's something that we can bring to say, what would we expect to change quickly and what would not?
Thank you. So we have a question here in the middle in person. Thank you. Sorry,
Okay.
try again.
Thank you. Now, I was just saying thank you very much, Nancy, and thank you to all the panelists, because it's really, really interesting discussion. I learned a lot. My name is Charlotte Gojewski. I work at City University of London, and my question is about power and theorization of power. I'm really looking forward to reading the book, but I'm not yet familiar very much with ecosocial theory. And so what I was kind of wondering is when you conceptualize the link between what is ultimately the sociopolitical realities with the body, which I think is so fascinating, and I'm really looking forward to reading it. How do you make sense of power, or how do you theorize it, so to speak?
So very briefly, I mean, power is obviously a very, very big idea, and it's also a lived reality, and above all, it is a relationship. And so there is the power to deny people their abilities to have autonomy and to act. And there is power that becomes, and this word has been terribly misused, but there is power that empowers people, that people actually have power to shape their own lives and their destinies. So there's not just one thing of power, but its power is always about relationships between groups. And that's the lens that I use, but recognizing that there's power for good and power for ill, power that is about constraining others, power that is about making people able to live the lives of dignity that everyone ought live.
Thank you. So we have another question online, and this may need to be our last question. So thank you to this amazing panel all. Dominique Berg says, my question relates to the role of social epidemiology and ecosocial theory for better theorizing change. So mechanisms of change beyond mainstream interventions impact research in public health, which can be so reductionist and downstream. So how has ecosocial theory influenced mainstream epidemiology and public health in this regard?
I'm going to just say a little thing and then leave time also for other people to speak. But one is, I'm very clear that there are dominant theories and there are alternative theories, and that's what I teach. And so dominant is biomedical and lifestyle. So yes, I think ecosocial theory and other social epidemiologic theories are having some impact, but I would never want to overstate what the impact is, although we're working hard to change that, many of us doing the different things that we do. So that's one point. But secondly, the other point about thinking about change is that what ecosocial theory is also offering is a way to use the idea of embodied truths and that integration of experience as something to help in framing the different groups that need to work together to make change, not to have it be so segmented. And so I do work in this issue, you do work on this issue, and never the twain shall meet. Because our bodies are integrating our experiences and our lived realities and the biophysical and societal context and the history behind it. That's what we do. I mean, that's called living. I mean, if something is not embodying anything, it's probably not living. And so it's really core to understanding life on this planet, because life is a historical process that we live, we create, and we change. So that's one point to consider. Another point is that in ecosocial theory and in some of the papers that I've written, I explicitly reject the metaphor of upstream and downstream. And I reject the ideas of quote unquote proximal and distal, unless that's really truly speaking to like time frame, which is something happened quickly, event A and then event B happened quickly, and then that might be proximal temporally, or event A happened and took a long time till it got to event B, and that's a distal. Because a lot of the proximal, distal, or upstream, downstream framing makes it like levels don't interact in different complex ways across levels. And that's not true. That's not how social change happens. Social change happens in part because there's an awful lot of things that are happening at the groups combining together of quote unquote individuals that end up changing social structures and policies. Upstream, downstream always has it that what's upstream is what really changes things. But who makes upstream change? And it's always interesting to me to think that, again, to go back to this use of metaphor, when you actually think about upstream and downstream, right, where a river starts is like, usually up in the mountains, and it's a little thing. And then it manages to flow to like where it empties into the sea. That's called a river. And when you think about upstream and downstream that way, actually, often most of the activity, you think about Boston as a harbor city off the Charles, happens downstream. Upstream is what feeds that, but you need to think about, again, the process of it. And so, and you think about London where you are, I mean, it matters immensely. You have the Thames, that's like a non-trivial river in your midst, and the connection of many waterways. So I think it's really important to be thinking that the upstream downstream framing ends up in many ways acting like only upstream matters and not how downstream managed or organized. In the US, for example, back to the abortion case, which I've written about, is that it actually was a case of skipping levels, because by saying that it's a right at the individual level, which is obviously great under attack, it ended up changing all these other relations of laws that ended up affecting state policies because of the way that the federal law happened. And that went, so that the arrows go in different directions, but not with equal force. And what's important is you can have very powerful arrows that go from the quote unquote top levels, societal structure and governance, down and have huge effects. But lots of people, lots of individuals organizing together, back to Linda's example around what the Black Panthers were doing with their food program, which is teaching people to think about why it was that food insecurity is distributed as it is in a society. Lots of people coming together can band together and make change. And that's the only way change has ever happened.
Thank you. Would any of the other panelists like to give some kind of closing words?
Read the book and enjoy it.
Excellent. I think that that is an excellent way for us to leave here. For those of you who are in person, you're welcome to join for a reception down the hall. For the rest of you, we really hope that we will be able to meet with you in person at some point someday. And in the meantime, thank you so much for taking the time in the middle of your days to impart your wisdom on us here in London, and to those of us who are joining remotely. So on behalf of King's College London and Global Health and Social Medicine and all of your fans here, thank you very much.
Thank you.
Thank you so much.